Yeah, good morning, Mika. Right now, only about 2/3 of Americans across the country who are eligible for the COVID vaccine are even partially vaccinated, as the Delta variant pushes up cases in every state. In a moment, NBC's Gabe Gutierrez reports from a hospital in Florida, which once again has become a hotspot. But first, NBC News correspondent Miguel Almaguer has the latest on a new call for all school children over the age of 2 to wear masks.
With children nationwide soon returning to the classroom, the American Academy of Pediatrics says all students older than 2 and staff should wear a mask at school, an added layer of protection for the 48 million kids under 12 who still don't qualify for vaccination. The former Surgeon General and others suggesting whether Americans are vaccinated or not, universal mask wearing is needed again.
It's not like we're asking people to go to the trenches with shooting war. We're just asking you, if it looks like it's going to help, put the mask back on for a while.
The face of the nation's most divisive restriction is more than just a new mandate indoors in Los Angeles County. As COVID cases spike here by 300%, 10 additional counties are also recommending the fully vaccinated use face coverings inside public spaces. Cities like New York not yet going that far.
We do not intend mask mandate. We do intend to double down on vaccination.
While CDC guidelines say the vaccinated don't need masks, less than half the U.S. population is fully inoculated. And as new vaccinations plummet by more than 35%, infections, hospitalizations, and deaths continue to soar.
It's far more virulent. Patients that otherwise could handle a viral infection reasonably well, getting very, very ill.
The fight to get more Americans vaccinated is also a battle against misinformation. The president now walking back comments after pointing the finger at Facebook Friday.
My hope is that Facebook, instead of taking it personally that somehow I'm saying Facebook is killing people, that they would do something about the misinformation.
At UF Health in Jacksonville, the COVID resurgence has been ferocious, almost overnight.
I thought for a while we saw the light at the end of the tunnel with only one COVID positive patient, and now there hasn't even been enough time to realize that we're back to where we started.
Cases here are doubling each week. Florida now accounts for 1/5 of new infections in the entire country.
We're gaining cases at such a rapid rate, we don't really know where it's going to stop.
Statewide, hospitalizations and deaths are still far short of where they were in January before the vaccine was widely available. But these nurses say it is busier, at least here.
This is one of the hospital's 4 COVID units. At the start of Sunday, the hospital had 86 COVID patients. Now, 123, a more than 40% increase in just one day.
It was just insane to go from having one COVID patient to having all COVID patients again. And it's just insanity. It really is.
About 85% of seniors in the state have been vaccinated. But there are people like 65-year-old Deborah Wells.
Did you get vaccinated?
No.
We spoke with her by phone through her room's window.
Why didn't you get vaccinated, ma'am?
I was scared.
She's been here since Saturday.
Do you regret not getting vaccinated a little sooner?
I regret it. Yes, I do. I was dying. I wouldn't wish it on my worst enemy.
Gabe Gutierrez reporting there. Let's bring in Dr. Vin Gupta. He's a pulmonologist and an NBC News medical contributor. Dr. Gupta, it's great to see you. Boy, here we are again. I'm thinking back to February of 2020, before even most of us realized how serious this was. You all in Washington State had the first death in the United States. You've been treating COVID patients since back then. What is your assessment of where we are right now, and can we stem this tide that seems to be coming?
Good morning, Willie. Great to see you. You know, I think it's important for us as a nation to remain calm and to recognize that even if cases are increasing, they're decoupling from hospitalization trends across the country. Yes, there are some zip codes that are having that are hotspots, as mentioned, but across the country, the bigger trend here is that hospitalizations and deaths still remain at some of their lowest points in the last 18 months. That's a great thing. We need to remind the people that are not vaccinated. I I think we need to stop talking about reinstituting mandatory mask mandates in big counties across the country that may not need it, and really double down on our messaging to those who've remained unvaccinated. That's going to be really key here, because we do know that 2 doses, especially of the mRNA vaccines, are very protective against the Delta variant if you're otherwise healthy. Now, let me just say here real quick, there's these vaccine breakthrough cases. We're hearing a lot about it from the Olympics, Willie, and elsewhere. Typically, if the rare individual who tests positive, even after they've been fully vaccinated, usually they're mild and or completely asymptomatic in terms of illness. It's only if they're, say, over 65 years of age, or generally if they're immunocompromised. And again, exceptionally rare event, do they end up in the hospital? Very rare, but it's the vulnerable here. So we need to decouple who we're worried about with the Delta variant, even if you've gotten vaccinated. It's those that remain vulnerable. That's why a booster shot's going to be really necessary for that particular group. But for everybody else, we should just look at the positive trends here and really focus in on that. We're making a lot of great progress overall.
And the bottom line is, others had said time and time again, if you get vaccinated, you are all but completely protected from serious cases of COVID and from death as well. The statistics bear that out. It's interesting you talk about the messaging. There was a big turn yesterday. Something happened internally, I guess, at Fox News, which is very important because that's a completely different media ecosystem, where they were coming out publicly, many of their hosts, including Sean Hannity, in primetime saying, I got vaccinated. You should go get vaccinated. I believe in the science. We need to go get this done. You mentioned masks. We got that guidance from the American Academy of Pediatrics, which stopped a lot of parents in their tracks yesterday, that said they're advising kids should wear masks in school this fall. What do you make of that guidance? A lot of us thought perhaps we were through this and our kids could get back to some semblance of normal life at school come fall.
Well, you know, Willie, I agree with it, because those individuals 2 and up, to even say adolescents to 12 years of age, they're not yet eligible for the vaccine, and we have no way to standardize between 12 and 18. Are they not fully vaccinated? So to me, this is a conservative approach that makes sense, because the majority of people, young kiddos in school, will not yet have had access to the vaccine, and we know that even though it's rarer, kids can still have very severe adverse effects from this virus. So that's number one. Number two, to your point about Fox News, if I may, just real quick, Willie, I think they're recognizing that they could be potentially culpable for putting out misinformation that could kill people. At this point, saying not to get vaccinated, which some of their anchors still continue to draw questions on or inject some uncertainty about whether or not you should get vaccinated, or whether vaccinations are correlated to death, for example. There's some very well-known anchors that continue to do that. I think they're recognizing that that's actually that they might be culpable in a court of law, that is actually putting out misinformation that is harming people.
Yeah, this is all going to be really looked at down the road in terms of where this disinformation is coming from and who is responsible for it. 2 questions for you, Dr. Gupta. You talk about the risk of unvaccinated people giving COVID to the Delta variant to vaccinated people, and them maybe not getting as difficult to symptoms or really not feeling symptoms. But isn't there still the risk that vaccinated people who are infected with the Delta variant then can spread it around to others who are not vaccinated? I mean, it doesn't stop the spread, does it?
Mika, thank you for asking that question, because that's something I get all the time. There is no evidence that's published suggesting that if you're otherwise healthy, so that's going to be the key operative phrase there, otherwise healthy, so not immunocompromised and fully vaccinated, and my definition of fully vaccinated is 2 doses of the mRNA vaccine, that individual, and that's a lot of people across the country, there's no evidence that they can transmit even if they test positive. So you're probably wondering, well, why do we call that an infection? If somebody's asymptomatic and they cannot transmit, Mika, our medicine just doesn't have the right dialect. We call that an infection, but testing positive if you're not asymptomatic, if you're asymptomatic and you can't transmit, that's not really an infection. So we need a new word.
And Dr. Gupta, in terms of the disinformation, and for those who are unvaccinated because they're choosing not to be and they are depending on information that is scientifically incorrect, what do they need to hear from? Who do they need to hear from to perhaps help them make the right decision for their own health?
I think they need to hear from more authentic messengers that have been in the fight, that have been caring for their peers. My colleagues, for example, myself, others who've actually been caring for younger people in ICUs and in hospitals across the country. And I think, Mika, we need to take a page from the most successful public messaging campaign in history, the anti-smoking campaign that is targeted towards youth. And we spared no expense, and we really focused in on graphics, visualizations. This is your lung with COVID. This is your lung without COVID. We need to go to those searing graphics, storytelling to really reach the unvaccinated.
Well put. Dr. Vin Gupta, thank you very much for being on this morning and being on this issue.